In this video, we gonna see how zinc may shrink prostate, food sources rich in zinc, supplementation, best time of the day to take it, how many milligrams is recommended, problems regarding its absorption, and risks related to excessive consumption of zinc. As men age, the chances of developing issues with the prostate, such as benign prostatic hyperplasia (BPH) or prostate cancer, indeed increase. The American Urological Association reports that about 50% of men have histological evidence of BPH by age 50 and 75% by age 80. However, only half of these men will have symptoms that require treatment. The incidence of BPH rises steadily with age due to hormonal changes in the body that influence the growth of the prostate. It is important to differentiate BPH from prostate cancer, as both conditions can cause similar symptoms, including difficulty with urination, a frequent need to urinate, and a feeling of not being able to completely empty the bladder. Prostate cancer can be more serious than BPH and requires different treatments. It's typically diagnosed through a combination of a digital rectal examination, blood tests for prostate-specific antigen, PSA, and biopsy, where a sample of prostate tissue is examined under a microscope. If BPH is the diagnosed condition, certain lifestyle changes, including dietary changes, can help manage symptoms and potentially reduce the size of the prostate.
Hi, I am Rob from Explaining Health. Every week I would like to share my medical knowledge.
Zinc is an essential mineral that is found in high concentrations in the prostate, and it is known to play a key role in prostate health. Some research suggests that zinc may have several effects that could potentially contribute to the reduction of prostate size or improvement of symptoms in benign prostatic hyperplasia (BPH). Zinc's potential effects in the prostate include 1. Regulation of prostate cell growth. Zinc may inhibit the activity of certain growth factors and enzymes involved in prostate cell proliferation. This could potentially help to control the growth of the prostate. 2. Antioxidant properties. Zinc has antioxidant properties, meaning it helps neutralize harmful free radicals in the body. Free radicals can cause oxidative stress, which is believed to play a role in many health conditions, including BPH. 3. Hormonal effects. Zinc might affect levels of androgenous male hormones such as testosterone that play a role in prostate growth. Some research suggests that zinc could inhibit the activity of 5-alpha reductase, the enzyme that converts testosterone to its more potent form, dihydrotestosterone (DHT). DHT is known to stimulate prostate growth. 4. Anti-inflammatory effects. Chronic inflammation is thought to be a factor in BPH, and zinc might have anti-inflammatory effects. 5. Apoptosis. Zinc might promote apoptosis or program cell death in prostate cells, helping to limit their growth.
If you like this kind of content, hit the subscribe button in order to avoid missing the next videos.
Once we know the importance of zinc in prostate health, here are some zinc-rich foods. 1. Shellfish, particularly oysters, are very high in zinc and are generally considered good for prostate health. However, they should be consumed in moderation due to their high cholesterol content. 2. Seeds. Seeds like pumpkin, sesame, and flax seeds are rich in zinc and have also been suggested to support prostate health. 3. Nuts. Nuts like almonds and cashews are high in zinc and beneficial fats. Walnuts, in particular, contain omega-3 fatty acids, which are good for prostate health. 4. Legumes. Legumes such as beans, lentils, and chickpeas are a good source of zinc. They also contain other nutrients and fiber that support overall health. 5. Poultry. Chicken and turkey are good sources of zinc and lean protein. 6. Fish. Certain types of fish, such as salmon and sardines, are not only good sources of zinc, but also rich in omega-3 fatty acids, which have been suggested to be beneficial for prostate health. 7. Whole grains. Foods such as brown rice, oats, and whole grain bread contain some zinc. 8. Certain vegetables. Some vegetables, like mushrooms and spinach, have moderate amounts of zinc.
Are you enjoying? Do not forget to leave a thumbs up.
As an alternative, various forms of supplementation are available. Common ones are zinc citrates, gluconates, glycinates, and picolinate. The safe intake levels for zinc are outlined in the recommended dietary allowance is RDAs, and tolerable upper intake levels ULs. For adults, the RDAs for zinc are men age 19 and older, 11 milligrams per day. The UL for zinc, which represents the maximum amount of the nutrient that most people can consume daily without risk of side effects, is 40 milligrams per day for adults. Therefore, it is safe to stay far from this limit unless your doctor gives you another orientation. What is the best time of the day to take zinc? Some people prefer to take it in the evening with dinner. It can be a good idea to take it at a time when you're also eating to reduce the chances of stomach upset. Zinc can also interfere with the absorption of copper, so if you're taking both, they should be taken at different times of the day. 2 milligrams of copper daily is a great choice. The problem is not always about zinc intake, because as we age, the absorption of zinc can become difficult. And there are also some medications that interfere in this process. For example, some diuretics used to treat high blood pressure like thiazides can increase the excretion of zinc in urine, potentially leading to deficiency over time. Besides that, proton pump inhibitors (PPIs) medications, which reduce stomach acid to treat conditions like acid reflux, can potentially interfere with zinc absorption. Another situation is chronic alcohol consumption, which can lead to low zinc status because alcohol increases urinary zinc excretion. Alcohol can also damage the lining of the stomach and intestines, which can decrease the absorption of many nutrients, including zinc. Also, it's important to note that taking excessive amounts of zinc can lead to harmful side effects, such as interfering with the body's ability to absorb other essential minerals, like copper. High levels of zinc can also cause nausea, vomiting, loss of appetite, abdominal cramps, diarrhea, and headaches. While zinc plays a role in maintaining prostate health, it's important to understand that BPH is a complex condition, and it's not clear that zinc supplementation alone can prevent or treat it. It's also crucial to note that while zinc is necessary for health, too much zinc can be harmful. Overall, management of BPH usually involves a combination of lifestyle changes, such as diet, exercise, and regular medical support. Subscribe.